Melatonin is known for its role in sleep control, but it has a range of other roles and potential benefits. Optimal levels will ensure proper sleep quality, brain and gut health, reduced inflammation, and more. Melatonin levels are a marker of sleep quality and overall health. Melatonin supplements can increase levels. In a review of 35 studies, researchers found that melatonin supplementation slightly improves sleep quality. Melatonin shows promise in improving insomnia and reducing jet lag. It also does not have any serious side effects. Although the optimal dose is not yet determined, researchers recommend a lower dose range. Even at low doses, there's already a significant increase in melatonin levels after administration. The recommended dose range for elderly adults is 0.3 to 2 milligrams around 1 hour before bedtime. Folate and vitamin B6 boost the formation of serotonin, which is a precursor of melatonin. In rats, vitamin B6 injections enhance melatonin's production. After 2 months of B6 injections, the blood levels of melatonin increased by 35%. Additionally, zinc and magnesium increases the formation of melatonin from serotonin. They bind and activate the AA-NAT enzyme. This increases the affinity of serotonin for binding to the AA-NAT. Zinc supplementation increases the melatonin levels also in rats. Certain foods are high in melatonin, like tomatoes, walnuts, barley and rye, strawberries, cherries, olive oil, unprocessed cow's milk, grape wine, and beer. Certain things can decrease the melatonin, such as beta blockers. These are drugs that help to lower blood pressure. They decrease melatonin's release. They do this by inhibiting specific receptors. And non-steroidal anti-inflammatory drugs, including aspirin and several other over-the-counter painkillers. These suppress nighttime melatonin levels. Blue light exposure at night can reduce melatonin levels and narrow the time window of melatonin secretion. The pineal gland, which produces melatonin, contains cells called pinealocytes. The number of these decrease with age. This then decreases the melatonin production. Fasting reduces the nighttime secretion of melatonin. Short-term fasting for 2 to 7 days reduces blood melatonin by 20%. Deficiencies in folate, magnesium, and zinc are linked to lower melatonin levels in rats. During aging and Alzheimer's disease, MT1 receptor expression in the SCN and the cortex decreases. MT2 receptor expression is also reduced during Alzheimer's disease. Caffeine also blocks melatonin signaling and transmission. Vitamin C, vitamin D3, and vitamin E are important antioxidants. Melatonin has antioxidant activity. It can synergize with each vitamin individually to make a more powerful effect. In animals, alpha-lipoic acid worked to scavenge free radicals. This means that it stops oxidative damage and it has antioxidant activity. When used in combination with melatonin, alpha-lipoic acid stopped DNA damage 3 times more effectively than when it was used alone. Melatonin and alpha-lipoic acid work together to protect calf DNA from oxidative stress. Glutathione is a potent antioxidant and it decreases lipid or fat breakdown. Melatonin and glutathione combined had a greater antioxidant effect when either was given individually. Their antioxidant activity combined to have a greater effect in rats' livers. Melatonin also helps to stimulate glutathione activity in the rat's brain. They work together to eliminate peroxides and free radicals that can cause oxidative damage. Selenium has free radical scavenging effects. It protects nerve cells and it restores the activity of antioxidant enzymes. Melatonin and selenium work together to improve the treatment of brain ischemia and consequent damage in male rats. This combination helps to reduce injury and to prevent brain inflammation. Epigalloglycan gallate, or EGCG, is responsible for most of the antioxidant effects of green tea. It prevents oxidative damage and it protects cellular DNA. However, high doses of the EGCG, or the green tea extract, can cause hepatotoxicity or liver damage. Melatonin reduces the toxicity due to the EGCG overdose. In one study, researchers gave mice toxic and lethal doses of EGCG. Melatonin extended the survival time of the mice who were given the toxic doses. Meanwhile, it also helped to reduce liver injury caused by a non-lethal toxic dose of the EGCG. Resveratrol has both antioxidant and anti-inflammatory activities. However, it can also exhibit pro-oxidant action and contribute to oxidative damage in excessive amounts. Resveratrol, in the presence of other antioxidants, loses its pro-antioxidant action, and it acts as an antioxidant. Melatonin was highly effective in reversing resveratrol's pro-oxidant DNA damage in calf DNA. However, they do not combine to make a greater synergistic antioxidant effect. An interesting new study on autistic children who tend to self-isolate and avoid interaction were found to be very low in melatonin. With high-dose supplementation, their sleep deprivation decreased, and they showed improvement in social interaction. This may imply that many social anxiety disorders have a component of exhaustion and burnout related to them due to insufficient restful sleep as a result of disrupted melatonin. The opposite research chemical to melatonin would be SR9009, as it is showing promise in treating many autoimmune conditions. It was developed as a cure for jet lag. If this was taken during the day, along with thyroid support such as iodine and selenium, this may further help to regulate the circadian rhythm and to improve one's overall health. For more information about the other related powerful antioxidant supplements, check out my videos on alpha-lipoic acid, glutathione and coenzyme Q10. Also, check out my videos on hypo and hyperthyroid for more information about regulating the thyroid function. Finally, there's also a myth that supplementing with melatonin causes your body to stop producing its own melatonin. However, studies have shown that this is not the case, and there is little need to worry about damage or addiction from melatonin doses. The best form of melatonin, however, appears to be slow release, as melatonin has a very short window where it's effective in the body. For more information about herbs, supplements and health conditions, check out my website.